Hey everyone, this video will provide an overview of the practical playbook for addressing health misinformation, published by the Johns Hopkins Center for Health Security. The playbook provides guidance on how public health and medical professionals can set themselves up for success, decide if they'll address health related rumors, choose how to act, develop messages to address rumors, and evaluate their efforts. It provides tools, templates, and examples to help you do that. And although there's no silver bullet to solve the problem of health misinformation, the playbook lays the groundwork to address the issue. To learn more about this topic and to gain access to helpful resources and tools, we recommend exploring the rest of the Trust in Public Health website. For direct access to just the playbook, you can also scan this QR code. The practical playbook builds on CDC's Health Information Management and Alert System, which provides a framework to approach health misinformation in 4 phases: pre-planning, monitoring, analysis and insights, action, and evaluation and refinement. The playbook is divided into 4 sections with tools, tips, and a closer look at specific topics sprinkled throughout, as well as appendices with additional practical tools at the end. The guidance is aimed at public health practitioners who may not have a lot of resources to tackle rumors. At the end of each section, we'll list some things to do if you do have more time and resources.
Before you even confront health-related rumors, it's important to set yourself up for success. Before a public health event escalates, you can start with pre-work, or activities like thinking about rumors that come up repeatedly in your community, preparing people to detect false information or misleading information in advance, and building your community's trust in public health. During pre-work, you may also want to assemble a multidisciplinary team, like communications personnel, social media technical staff, subject matter experts, and partners, to address misinformation in a quick and coordinated way. You can connect with communities and build partnerships. Relatedly, you can get to know your audience and plan to meet their unique needs. You may also want to set up a way to track misinformation. For instance, social listening can help to identify rumors and information gaps that come up. This can look like monitoring comment sections, asking community partners about any health concerns or health rumors they're hearing, or even using more robust tools like Google Alerts and Meltwater. Of course, one of the best and most efficient ways to keep rumors from even becoming a problem is to answer people's questions and concerns as they come up. It is important to pay attention to people's questions and concerns in real time, especially when a public health issue is escalating or when a new intervention or guidance comes out. Addressing concerns quickly, directly, and honestly as they evolve is easier than trying to expose, correct, or refute misleading information later. So suppose your social listening efforts have informed you that there is a health-related rumor going around. What do you do next? Your first step is to decide whether you should address that rumor at all. To make this decision, start by identifying your goals or objectives for responding, as well as the intended outcomes of your messaging efforts. Then, identify what influences your decision to respond. Many factors will influence whether or not you even choose to do something about a rumor. You and your team can work together to identify, define, and weigh these factors, which can include how serious the viral rumor is, whether your team has the capacity to act, and whether potential negative consequences might come up. Our playbook includes a downloadable worksheet on page 11 to help you prioritize these criteria and make your decision. To make your decision about taking action, you'll need to identify whether the factors that matter to you meet certain benchmarks to warrant acting. This includes benchmarks that would immediately trigger action if they're met, like a rumor results in high levels of harm, as well as benchmarks that, if they're not met, mean that you can't act at all, like not having enough staff available to carry out a response. In many cases, addressing a rumor may not be the right choice, and your decision-making process may change during emergencies because your priorities will also change. The next step, step 2, is to take action to address misinformation. Guidance in this section of the playbook will help you and your team identify how to address misinformation through strategically crafted messages. Each section of step 2 includes a worksheet to walk you through the process. You and your team should first understand the type of health-related rumor that is circulating. Rumors tend to repeat common narratives, such as concerns about the safety of an intervention, dismissing or exaggerating risk, blaming specific populations, or a desire for certainty in confusing situations. Deconstruct the rumor to identify, what is this rumor trying to achieve? How can we resolve it? Will it harm people? After you detect and understand the rumor, you can characterize your priority audience and identify your communication goals for them. To do this, create a priority list of audiences that you want to reach with your response messaging. The playbook suggests prioritizing people who are disproportionately impacted by or more likely to believe a rumor, then expanding your efforts to general audiences. For each priority audience, select relevant communication goals. Increasing awareness of accurate health information is usually a great goal to strive for, regardless of the rumor, as it is appropriate for all priority audiences. Another goal could be to increase people's ability to detect false information, which is best suited for people who are disproportionately impacted by a health rumor, and then general audiences. Finally, if your goal is to increase people's understanding of factual alternative explanations for misleading information, then focus on people who are most likely to believe in a rumor. Throughout this process, work with trusted partners and secondary messengers when developing messages. For every audience, we suggest first focusing your efforts on increasing awareness of accurate health information and then moving on to other strategies. Now that you know your goal and audience, you can choose an approach for taking action, particularly by developing messages to counter a health-related rumor. Depending on your communication goal, the playbook recommends up to 6 potential actions. Number 1, amplify accurate information. This could look like sharing information from or pointing people to trusted sources. Number 2, fill information voids. You could quickly provide credible, easy to understand information to fill gaps in people's knowledge before this gap is filled by misinformation. Number 3, leverage trusted messengers and engage communities. You could collaborate with spokespeople who your priority audiences trust to develop and convey your message. Trusted partners or other secondary messengers often have long histories of working with communities that may be disproportionately impacted by a rumor, but don't always trust public health practitioners. Number 4, refute, fact check, or debunk the rumor. You'll want to start with stating the facts, exposing that a claim is false, explaining why it's false, and reinforcing the factual alternative explanation. Number 5, pre-bunk and inoculate. This involves preemptively refuting false information that you anticipate coming up or preparing people for tactics that might be used to manipulate them before they are exposed to a rumor. And number 6, improve health and science literacy, particularly by explaining key public health concepts, terms, how research is done, etc. The playbook includes examples for all of these actions. The first few actions require fewer resources to implement, while the final few actions require more resources. Starting on page 21, the playbook also provides a list of do's and don'ts, or tips that you can use to maximize the effectiveness of your approach, while avoiding potential negative consequences, of course. Next, you'll select communications channels where you will distribute your message to address a health-related rumor. The best communications channels are ones where the rumor is already actively spreading. So prioritize these channels based on factors like their audience, popularity, user-friendliness, and trustworthiness. Figure out how you can make your messages accessible and maximize their reach. Next, you'll choose how to strategically frame your message. Different audiences interpret messages differently, so you can use rhetoric and persuasive techniques to help your message resonate with your audience. For example, a common strategy is to match your message to the motivations of your audience and framing information that audiences might not easily accept in a way that aligns with their moral values. The playbook recommends some framing strategies and provides a few templates to help you do so. All of these recommendations are meant to help you develop a message that you can put out into the world to address any health rumors that come up. There are many good practices around structure, tone, visuals, and language that you can use to craft your messages. We recommend leading with empathy, using plain language, connecting with audience values, addressing misleading claims directly, among other suggestions. Then, disseminate your message using strategies that are tailored to your priority audiences and communications channels. It's important to understand that sometimes it may actually not be appropriate to respond to a rumor. Maybe you don't know enough about the situation, or your team needs to prioritize other more pressing tasks. Still, there are some low stakes things that you could do. You could build relationships with internal and external partners and support their work. Once you've identified trusted voices, you could amplify them. Continue to engage in community outreach and be present at community events. And finally, you can continue reassessing your decision not to act in case the situation changes. The final step, step 3, takes place after you've put your message out into the universe, and that's evaluating your message. It's important to gather feedback and make sure that your messages are readable, accessible, and relevant, because if they're not, you might need to change something. Understanding the impact of your message can be challenging, but start with whatever you can do. This could look like tracking your social media analytics to see how well you connected with your intended audience. You could also ask community members and partners for feedback on how people are reacting to your message. We've provided a quick overview of the practical playbook, but please read the full playbook if you're interested for more specific guidance and resources. Public health communicators often don't have a lot of resources at their disposal, so the playbook's guidance is meant to be practical for even the smallest of teams, with options to level up if you have time and resources. Finally, there's an appendix at the end that includes worksheets, strategies, and templates to help you apply what you've learned.
We hope that the playbook helps you make timely decisions and take practical actions to address health related rumors. Let's take a second to recognize that you could do all of this and still not successfully counter misinformation, but it's a good start. At its core, the playbook emphasizes three key points. The first is that there's no one size fits all solution to countering misinformation. So, confronting rumors necessitates tailoring your approach based on your goals, audience, and capacities. The second is that there are tangible steps you can take before rumors arise and before a public health event escalates in order to set yourself up for success, which means that you can mobilize more quickly and effectively in the future when you need to do that. And finally, regardless of which actions you take, you need to form strong partnerships with communities, organizations, practitioners, and trusted messengers in order to make sure that your message to counter health related rumors actually makes an impact and changes beliefs, behaviors, and outcomes. Thanks for watching. We would like to thank the research team and experts who have contributed to this work. Thanks so much.